Indian economy has undergone a sea change ever since the new government has taken over. But have things actually changed on the ground as well? Since there has been a lot of focus on the healthcare sector, so let's take a view from Mr. Malvinder Mohan Singh, Executive Chairman at Fortis Healthcare. Thank you so much, sir, for speaking with us here on NDTV.
It's a pleasure.
So let's start with how things have changed. Look at last year and look at today. Situations have actually changed. You've got a GDP growth above 5%. You've got an inflation which is under control. A lot of reform measures are being announced. A lot of them are in the pipeline. What do you have to say of the last 6 months of this new government?
I think it's been extremely positive. The perception, the sentiment in the business community, in the country is extremely positive compared to where it was for the last 2 years. If you look at what people are talking and engaging in conversations and discussions and wanting to make investments at a global level, I think the fundamental view of India has changed. People are very interested, very keen to come into the market to make investments. And over the last 6 months, you've also seen a lot of business people in India, companies making acquisitions, making expansion plans, international people wanting to put in more money as FIIs, FDI coming into the country. So I think all of this really indicates that the economy is on the rise, is on the upswing, and probably the worst is definitely over. Now the question is, how quickly do we inch up as we move ahead?
You're saying the worst is probably over, but if you look at the GDP growth rate, if you look at the fundamentals which seem to have changed at this point in time, nothing significant has changed on the ground. At least that's the sense we get from the corporates that we speak to. When we speak to the banks, the credit growth is not really picked up at the corporate level. When do you see that happening? What more do you think that this government can now do? They've made the first step. What more do you think that they can do now to bring that real growth on the ground back?
I think the government is doing a lot in different aspects. And even if you look at the reforms, if you look at some of the initiatives, if you look at the various things that they have done over the last 6 months, I think they're extremely positive. And I think the confidence that the country has in the Prime Minister is reflective in his actions, in his delivery, in what he's doing. And therefore, as we look over the next many months, clearly I think there is a very clear agenda on the government side in terms of bringing in some of the key policy initiatives and the reforms that they're looking at doing. But if you look, for example, in terms of where the economy is, and I think this is a clear call that we as a group and as a business house had taken a year and a half, 2 years ago, was to say, look, this is the best time to make an increased focus of resource allocation into the Indian market. So we actually began to exit some of our international businesses, took the profits from there and put all of that money into the Indian market when the growth rates were lower versus where they are today or where they've been historically in the past. So it was a call and a belief that we had on the Indian market and said, look, we want to be only India-centric. And that call today, in hindsight, looks as a very good call because of where the government is, where the growth rates are, and clearly where the trajectory of growth for the Indian economy is.
So do you look at monetizing some of your more assets in the international market? Do you just want to focus in India, like the Prime Minister has said, the target is Make in India, the campaign that he's now flagged off?
I think we've already done that. We started that in the end of 2012, pretty much through 2013 and the early part of 2014. We did all of that. So we have today monetized over the last year and a half, 2 years, our international businesses, brought all of that money into India. And I think over the next few months, really, Fortis will be virtually a zero-debt entity. And therefore, we have a very strong balance sheet. We are very much India-centric in our growth rate, in our focus as a market, and also the kind of expansion and the kind of need that you have in the healthcare sector. I think there's enough for us to do in India. And we are very focused on Make in India, on making sure India has the right capability and the infrastructure in the healthcare space to be able to create a healthy India.
You spoke about that your aim is to become a debt-free company in the next couple of months.
No, that's not my aim.
That's your vision?
No, it's not my vision.
All right.
I just made a statement that with the initiatives that we have, we will probably get there. But it's not my intent to be debt-free. I think a certain amount of debt is good.
Right.
But some of the actions that we are doing will probably take us in that direction.
All right. Can you tell us what is the current debt that you have in your books, and
it's around 0.2. Net debt is 0.2. It's very little.
All right. Talking about the
what I was trying to explain to you was, with the strong balance sheet, you have the ability to make expansion plans, to make capital investment plans for growth, to make acquisitions if you see a right opportunity within the Indian market, to be able to grow the business and be healthcare centric in India.
Let's talk about then Fortis Healthcare first, then we'll talk about the broad outlook that you have for the entire healthcare sector. For Fortis, what's your vision, say, for the next 3 years with the kind of initiatives that the government is taking? Do you think a public-private partnership kind of a thing is something that you might consider in the time to come?
I think we have a few public-private partnerships in some of the states. There is a huge opportunity because the government today has around 75% of the healthcare infrastructure. But yet close to 75% of the actual delivery of healthcare happens through the private system. And therefore there is clearly an opportunity to be able to work together, to be able to use existing healthcare assets that the government has with private skill sets to be able to do more than what is being done. And I'm sure, every entity in the private sector is exploring and engaging with various state governments of what to do and how to do. We ourselves have done some and are very open to doing more.
Can you elaborate a little bit more?
So I certainly see an opportunity, and I think in this area we really need to think out of the box. We don't need to look at the an incremental step in terms of a PPP, because yes, you can do that, we will be successful in that, but if we have to address the needs of the people from a healthcare vision perspective of India in terms of accessibility, in terms of affordability, in terms of reliability, then there needs to be a leapfrog in the way we look at it, in the way we think about it, in the way we actually go about executing it. And technology, to me, would certainly play a critical role in how you deal with this.
A lot of announcements, in fact, came in during the budget as well, when the finance minister spoke about having at least aims and making aims in every city. How do you think the corporate sector, Fortis Healthcare in particular, can be a part in actually giving healthcare, providing healthcare to the entire country, maximum, to the rural part of the country, which still lack that opportunity?
I think here technology will have to play a very critical link, because if you actually look for the country as a whole, if we have to kind of go out and build the healthcare infrastructure as a nation to be at par with what is expected at a global level in terms of, say, a UN indices, it would cost us $30 billion over the next 10 years. And of that $30 billion investment, the private sector would probably end up making 80% of that investment, which is $24 billion. Ideally, while each of us will do our bit, I really don't see a $24 billion investment happening in the healthcare space.
So you want basically the government to start?
I'm not saying that. I'm not saying that. What I'm trying to explain to you is that is the kind of scope in terms of investment that would be required. Similarly, in terms of manning these infrastructure from a healthcare perspective, you would need between 10 and 15 million people to be added to the workforce within the healthcare side, on the skilled side. Again, there's a skilled manpower shortage, and therefore this again, while it's required to be done, probably you will not hit that kind of numbers. And therefore, the criticality of technology as an enabler, as a connector, to be able to diagnose, to be able to treat, to be able to look at compliance in terms of healthcare. So therefore, technology becomes very important if we as a nation want to reach out to the people and be able to provide treatment to them in some of the rural areas where there is no healthcare.
Do you think government's initiative, which is like a digital India plan that they have, the vision that they have, do you think that could be a game changer when it comes to providing the healthcare to all as well?
I think digital is important in any aspect of our lives, whether it's in terms of financial services, whether it's in terms of getting the subsidies directly to the people and removing the chain in the middle, or it's in terms of healthcare or any other aspect of our lives. Technology is today is really redefining the way we connect, the way we work, the way we engage, and therefore even in the healthcare space we would need that. It'll be great in the next 5-10 years if we have a digital electronic medical record where you have your history electronically. So no matter where you are, no matter where you're traveling, no matter which system of a healthcare system do you go to, you actually have your data available, which can be accessed, seen, and then whatever you need as treatment is given to you. But today you don't have that. And I think we as a country need to evolve and move into that space. Lots of work to be done by all of us through different stakeholders in that value chain. But that's the kind of stuff that we need to do, and companies are doing.
Is the government's direction exactly what the corporate sector wants?
I think, see, the role of the government is different, okay? Because they have multiple, priorities that they need to look at. Health is certainly one of them. And they would play a role as a government in terms of creating an enabling environment, probably addressing the primary healthcare sector and certain other aspects. But I'm sure they would want to enable each individual to have health insurance, and therefore whether it happens through the private sector or whether different state governments or the government at the center comes out with a plan which enables an individual to say, look, I am covered by health insurance and I can take this health insurance and go to any provider, whether it's government or the private sector, to be treated, to be taken care of, to remain healthy. That, I think, would be a much more enabling environment for them, because they certainly have that ability to do that. The private sector has the ability on the healthcare delivery front to be able to provide that treatment.
So the government has to provide that enabling environment so that the corporate sector can actually work on it. You spoke about insurance in particular. Do you think now FDI and insurance, which has faced a lot of hurdles in the past, it's going to get through now in the winter session of the Parliament? Are you confident that some step, some measure would be taken?
We are all certainly hopeful. I think it's required. The sector needs it, and I'm quite confident it will happen.
And lastly, can you give us a sense of, what are your expectations as a corporate in the healthcare sector from this year's budget? I know it's a little far off right now, but still, if you could just tell me 3 things that you expect the government, be it in terms of the budget outlay, what exactly do you expect to hear in this particular budget?
I'll address 3 aspects, really. I think, and it's really not limited to a budget, but it's really from a healthcare sector. The industry needs, as I mentioned to you, $30 billion over the next 10 years in terms of investments. I think whatever the government can do to make this a more attractive proposition for the private sector to do as much investment as possible, I think that would certainly help. The second would be in terms of enhancing skilling in the sector. Whatever they're able to do, which will enable more educational medical colleges, medical institutions to come out, where people will eventually come out and take degrees. I think that will go on to address the need of the healthcare sector. And third would be in terms of having as many people as possible under health insurance, therefore they are able to afford healthcare delivery.
All right, so thank you so much, Mr. Singh,
Thanks
for speaking with us. So clearly, as you heard, 3 key things that the corporates are looking forward to, especially in the healthcare sector, from the new government. The new enabling environment is in place, but now it's the investment, it's the right kind of skills, and also health insurance is something that the corporate sector expects from next year's budget from the finance minister.